My name is Miranda, and I will be preparing to administer Rocephin 1 gram. This will be reconstituted with 9.6 mLs of sterile water. This will be infused over 30 minutes in a 50 ml bag of D5W. So the order here is for Rocephin 1 gram. So we have the Rocephin, and we have verified that it is the correct dose. And then here we have our sterile water. So what we will go ahead and do here is we will draw up 9.6 mLs of sterile water, and we will inject that into the Rocephin. Okay, we got 9.6. And we shake it. Make sure it's all mixed, and then we will go ahead and draw it up. Perfect. And we will inject this into our 50 ml bag of D5W. Perfect, now we can go ahead and hang the bag.
Alrighty, everything's already attached, already primed. We're going to turn on our pump. Let it boot up. Gonna click no. Channel select. We're gonna prime our flush first, which is normal saline. Yes. The rate. We're gonna do 100. How much we're gonna put in? We'll do 50. Once that's done, there's a button right down here that says primary, secondary. You're gonna click that. You're gonna find the medication. Scroll down. Right here's your medication. Is this weight-based or not weight-based? This is not weight-based. We're gonna use this right here. We can use this one, or we can use this one up here. Because 1 gram is also 1,000 milligrams in a 50 ml bag. Or you can use this one. You get to use that one to make it a little bit easier. Is that correct? Yes. You look at this, saying that's our dilution. That's our drug amount. You hit next. We have to program how long. You're gonna type in 30. And then we are going to start. Make sure you check all of your lines to make sure they are undone. And there we go.
Okay, Lerissa, so we got an order in to give Michael Thompson in room 112 a IV piggyback of Rocephin. Okay, so we're gonna come and look at the mark. We have Rocephin 1 gram IV piggyback every 24 hours. It has been reconstituted in the sterile water, and it has been injected into a 50 ml bag of D5W.
Okay.
So we are going to label it with the patient's name, room number, the medication, the amount, my initials, the base solution, the date, the flow rate, which is going to be 120 because we injected the 9.6 ml solution of sterile water with the Row 7 into the bag.
Okay.
So we're going to round it up to 10, and making this bag as 60 milliliter, and we want it to infuse over 30 minutes.
Okay.
So that would be 120 milliliters an hour.
Okay. Do we
Okay.
initial that label we're putting on?
Yes, we're
Okay.
going to initial and our title,
Okay.
and we're going to put it on the bag. We're also going to check if he had any allergies
Okay.
to the medication.
It looks like the MAR says he doesn't have any.
Correct.
Okay.
All right, and we're going to want our IV piggyback line,
Okay.
which is also the secondary medication
Okay.
line. Okay, so we're going to go into the room. Knock, knock, knock.
Hi, Mr. Thompson. I'm just gonna shut the door. Is that okay?
Yep. And we'll wash our hands, and we're gloved up.
Okay.
Hi, Mr. Thompson. Can I get your name and date of birth? Perfect. I'm just going to check your ID band. Perfect. And then we always want to double check the MAR
Okay.
and make sure that we are giving the right medication to the right person at the right time and right amount. Okay. So we've done that and everything is looking great. All right, Mr. Thompson, we're going to give you some Rocephin, okay? So we're going to just hang this bag here for a second.
Okay.
We're going to also make sure everything on this bag is correct.
And I see they even dated the tubing, so
Yes.
it looks fresh.
Perfect. So we're going to get our stuff out. This here, we're going to want to put our primary solution down
Okay.
below the antibiotic.
That's so the antibiotic infuses faster and first, right?
Yes,
Gotcha.
correct. Okay, so we're going to take this off. Gonna close this here for a second. We're going to take this off. We don't want to touch it.
Those must be the older bags.
Yes. We're going to drop. We don't want to touch the tip of this or that tube where it goes in. We're going to push it through, and you got to make sure you go straight up so that you don't accidentally puncture the bag.
Has that happened to you?
Yes.
Okay.
And it kind of makes a mess. And then we're going to take this hub off,
Okay.
and we're going to prime it. I'm going to squeeze this, get about half in there. Perfect. And we're going to prime our line. Okay, we primed our line. We are going to attach it to this hub.
Okay.
There, and then we'll get it going through the IV pump, and we'll open it up, and we will get this going.
Okay, perfect. Thank you, Mr. Thompson.
Thank you, and we'll come back and check on you here in a few minutes, okay?
Okay, thank you.